Hi, I'm Courtney.
And I'm Cira.
And we're tired.
Very.
But excited. If you see the people in front of us or see or hear any sounds, we've asked that they hold all jokes while we attempt to record this podcast. We are on the tail end of our 2024 Leadership Summit, which is exciting. But if you've ever attended any type of company event, you pack in as much as you can while everyone's in town. And I'm going to have to go home to take a nap and rest and recharge. So Cira and I thought today that we would take a chance to talk about a service that we do not offer at Smiley Aesthetics and the why behind it. So, of course, there's lots of legal and compliance reasons that we do not offer IV therapy services to our clients, but there's business reasons too, and clinical reasons. So, Cira, if you want to talk about some of the reasons, because you have in the past, right?
I have. And I always like to throw out pros and cons. And so I think everyone, I've had a lot of injectors come to me and say, when are we going to do vitamin infusions? It is a very popular thing. I think that it can be beneficial in the sense that it can help people to just generally feel better. However, when I did start offering vitamin infusions, I learned a lot. I initially started out as, I thought, I'm going to do mobile vitamin infusions. And I learned very quickly, actually. In fact, I did one mobile vitamin infusion, and I said never again.
Okay.
Because it was really a waste of my time. When you look at time, time is money. Mm-hmm. Time is money. And so it's not always about, the product and how much someone's paying you in that moment. You have to consider, well, how much time did it take me to drive there, set up, take
like that
down.
Time value of money.
Yeah. I mean, all of it. And so when you consider the amount of time that it takes, generally speaking, you're going to spend at least an hour and a half, if not 2.5 hours, depending on the drive. I live in a rural area, so you're talking going to be 2.5, 3 hours all the time. And so, a profit margin for a vitamin infusion, it may be $100. $100 in 3 hours is not.
That's not good money.
Not what I'm willing to go do on my time.
I think if you go to Chick-fil-A, you make more money and you get a free chicken sandwich.
Absolutely.
So, well, and I guess this is probably a stereotype, but my understanding of vitamin infusions, and it is a stereotype, is that it follows that hangover cure type situations. So talk to me clinically about when a vitamin infusion is actually even needed, how long you would see benefits from it, and also, some of the risks associated if you don't need a vitamin infusion. I mean, I know that we as a team have talked about this a lot. But there was actually a case in Texas where because the person had proper protocols and procedures for the good faith exams, what they thought was just a really hungover man ended up having a heart attack. And the person who was supposed to be giving him his IV therapy called an ambulance and saved the guy's life, because they were aware enough that this wasn't just a normal hangover that needed some, Gatorade in a bag. It was, he was actually in real severe medical trouble.
So, yes, it is known to be kind of a hangover drug, or not drug, but, treatment really. And that is good, but generally, if you think about it, what happens with a hangover?
Drink yourself to
it's
excess.
Good to just drink yourself to pure dehydration, because that's literally what it is. And so, is it really the vitamins that are helping you, or is it just the fluid? And anymore, they have the liquid IVs that you can drink, and it's loaded with electrolytes that are just as effective. You're getting a bag of normal saline. Well, that's salt water, right?
Yeah.
That's what it is. So eat you some salt, drink you lots of water, and you're going to have the same effect.
Like the age-old cure of like a bottle of water and some saltines?
Absolutely.
The Tylenol? Yeah.
Absolutely. And without the risk of infection, hypertension, heart failure, that's where you really have to get concerned when you have a patient that maybe has heart history and they don't tell you about it. And now you've just flooded their heart and their body with a liter of fluids. And that can be pretty hard on the heart if it's not a strong, healthy heart.
Yeah, I don't think I really understood that you know, an IV solution, that it's not, you know, it either, I guess my opinion or my thought was before is that it either helps or does nothing because it's just IV fluids, but that's totally wrong, correct?
Yeah, very wrong.
It could really hurt.
And kidneys. I mean, if you have underlying kidney disease and you've overloaded your kidneys with this fluid, I mean, that in itself could actually back up into the heart, into the lungs, and you get fluid overload, have congestive heart failure. There's actually a lot of, you know, there are risks there that if you're not careful, you can run into that. People can frequently pass out. And so, you know, if you have them sitting up in a regular chair and they pass out and face forward, I mean, so there's an injury. So not to mention the fact that a lot of the mobile infusions, they're going out. I mean, I've seen people set up in hotel rooms and, you know, just having people at resorts coming in and getting their infusions. And you think about the cleanliness of that. I mean, you're putting it in your veins. There's something to be said about that. So
like a direct path.
Direct path. So you can't tell me that it's always going to be super clean.
Intravenous is going to be
yeah,
in your vein to your heart. Yeah.
Yes.
That, I think that is a huge issue. And then you have the business aspect onto it too, that the profit margins really aren't there. And I swear I'm going to say this on every podcast and every time I'm given the opportunity to speak to anyone is you can play whatever music you want. You can have whatever cheers you want. This is still the practice of medicine. Yes. And what you just described is drastically different than drinking an extra, you know, Stanley thermos of water, drinking a liquid IV, drinking Gatorade. You are putting something in your vein, and that comes with severe medical risks. I mean, the person almost lost their life. Yeah. And when they got to I mean, you know, it's a coulda, woulda, shoulda situation. But when they got to the hospital, the medical provider said, if you gave someone this guy an IV, that like he asked in the middle of him having a heart attack, like he'd be toast. Yeah. There's no way that he would have survived. And then there's another issue too, where my understanding is that people who are doing these IV therapies, that we might have a little potion mixing going on that is not allowed. And in the world of medicine, getting into a compounding pharmacy type situation. So, you know, talk to us about compounding itself.
So there's a couple different scenarios with vitamin infusions. You can get each individual ingredient that you actually inject into the bag. And I mean, you're literally drawing one vitamin up at a time and injecting into the bag. A lot goes into that as far as deciding the osmolarity of the bag.
Oh, that's fancy.
Yeah. And so because basically fluid will push and pull, right? So if you get that balance off, it may push too much or pull too much into the vascular space. So that can create its own set of issues in itself. So there, you know, if you don't know what you're doing, when you're just injecting and throwing all these different vitamins in the bag and you have no concept of that, because we're not pharmacists, right? We're not trained to be pharmacists, then that could lead to a whole nother set of problems as well.
And so you can get the bags pre-mixed at an actual sterile compounding pharmacy, correct?
You can get the vials that are pre-mixed.
Okay.
And so, but you still have, you know, 2 to 3 vials that you're still putting in there. And so you're still inserting. Yeah. And so if you don't know or don't care, even worst case scenario, don't care, and you're like, oh, it's fine, I'll just give them a little extra today. I'm going to give a little extra. And you don't realize what that is doing on a cellular level, then yes, it could definitely pose some problems.
Yeah, and there's a reason that another reason we do not offer that here at Smiley Aesthetics, because safety and compliance are our top priority. So it is in fact compounding, and according to and I have some materials because we don't offer this. So I had to do some research on and giving you all some insight on to what you could look for if your spa does offer vitamin infusions, if you're thinking about offering it, if we can persuade you not to offer it. An attorney can probably always talk you out of anything because of the risk. So last year, the United States, we decided its pharmacopoeia released a new opinion that went into effect. We had a whole year to make it go into effect. It went into effect this year. It's USP 797. So if you want to look it up, you can. That regulates compounding sterile drugs into something like an IV. And it specifically says that hydration clinics fall under this guidance. So there are a couple of really great articles that I printed out that we will make sure I include in the description so you can look at them if you are somebody who offers IV therapy. So one of the first things it says, are you compounding when you are preparing IV vitamins? And are you subject to USP 797? So I'm going to read you exactly what it says. If you add more than one compounded preparation to a sterile bag for administration to a patient, then the answer is yes, and you are subject to USP 797. So you are being a compounding pharmacy. Tell me, how often does someone add more than one to a bag?
Every single time. Every single time.
Did you catch that?
Yeah.
So you might be right now acting as a compounding pharmacy. So what does that mean? Put your head between your legs and kiss your bum goodbye. What it means is that there are certain regulations that you have to have in place, certain policies and protocols for acting like a sterile pharmacy. So Cira's example of going to a hotel room,
absolutely not.
Going to the, a motel on the side of the road, it's probably not a sterile compounding pharmacy. How long you can store the once they're mixed. I mean, there's all kinds of things that can really go into this. And again, one of the many reasons that we don't offer it here. So I recommend that you look into this. So a couple of topics that US 797 covers, just for your general information, is personnel training and evaluation, the people who are actually mixing it, facilities, engineering, and control, like laminar airflow workbenches and clean rooms. I'm not sure that you have those in your facility. And no, you don't have them in a hotel. Aseptic techniques in handling, storage, and beyond use date of compounding sterile preparations, quality assurance and quality control procedures, and standard operating procedures. If you are mixing more than one drug, those are the types of questions that you need to be asking and need to be contacting someone to get you to help with if you can. And so the last component, and just so for your all's record, I printed this out. I'm going to show you. So this is a list of all of the states that require strict adherence to USP 797. So that's a United States nationwide regulation. Now, each individual state has their own rules, but of these 50 states, 32 states require strict adherence to US 797. And I'll give you a guess of the state that we're in. Tennessee is a yes. All but 2 of our states are absolute strict adherence. And so I haven't looked into this, but the other 2 states, I would imagine, are some version. What you normally see is if it doesn't say strict adherence, then they have some version and variation of the majority of the actual rules that are within the federal regulation. But 32, including Tennessee, absolute strict adherence to US 797. So, and I can, I'll attach that too, so you can look to see what your state says about it. And the last thing that I have that we will include is a pretty good advisory opinion. And this is back to one of our missions here at Smiley Aesthetics outside of the world of IV therapy. It is safe, compliant, convenient practice of medicine. And how do you do that in a way without ever sacrificing patient safety? Patient safety is our number one priority. when we are practicing medicine. So there's an advisory opinion issued by the Arizona State Board of Nursing. It actually applies to IV therapy to kind of give some guidance on how you would need to do it. But I would say for most of the practices that you are offering, if you are a med spa owner who's listening to this, it's a really good outline for what you need to do as far as a good faith exam. A huge issue across the world of medical aesthetics, where people think that just because it is medical aesthetics that they are not practicing medicine, and you will hear it from me over and over and over again, that we can cause some real issues if we are not taking. I mean, you threw out so many things in this short time that, like, I didn't know that.
Right.
Yeah, I didn't know that everyone is not a good candidate for IV. I mean, I guess I assumed that you just, would empty your bladder and anything that you didn't need, you would just be gone.
That's quite frankly the problem, is if you have somebody that is given infusions that don't fully understand the consequences, someone ends up in the ER with a heart attack.
Yeah.
And possibly, not making it.
Yeah, so this advisory opinion specifically sets out that it is within the scope of practice. This is Arizona. So if you're not in Arizona, you would just use this and as a guidance to see what your state would say. But in Arizona, that it is within the scope of practice for a registered RN, a licensed practical nurse, and an advanced practice registered nurse. Again, it's the Board of Nursing, so that's why we're only speaking to nurses here. Advanced practice registered nurse who has the proper education and proper training to administer intravenous fluid hydrations that have been properly compounded and that have an actual prescription. So what does that mean? Because an RN cannot write a prescription. It means that they have to have a good faith exam. It means they have to create that good faith exam, which is what creates the physician-patient relationship that has to be in place for things like, for reasons, like we said in Texas.
Right.
That APRN, or it was a mid-level, was the person who caught that the person was having a heart attack.
Right.
So they have the proper training and skills to catch those kind of things, to create and the physician in that case had delegated that ability to that APRN because of those skills, and can delegate it out there. So this is really great. It really sets out, down to the details. It's a pretty good guidance that you could use even if you are not in the state. And it also includes the rationale for why you need it in this case. And again, I think this can be applied to almost anything that we do in medical aesthetics, at least a general framework of, what do you need a physician-patient relationship for? And something we've really focused on this past week is the why. And I think you really spoke to a lot of the whys, because someone can really get hurt. Yeah, and there's a lot of variables. And now we've looped in the Board of Pharmacy. Now we've looked in compounding in sterile environments and low profit margins. So if you haven't already gathered from this podcast, there might be other services that are better to offer in the opinion of Smiley Aesthetics. But
so when you consider the profit margins in aesthetics, anything in aesthetics, to $100, and it takes, even if it's in one location, an hour and a half to run, it's just not worth it.
But you do you, boo. Just do it in a compliant way. So thanks, Cira, for talking to us about some IV fluids. And one of the questions I was going to ask, and I don't know if I did, is what are the benefits? Or how long do you see benefits? So Botox, you've got 3 months.
Usually maybe 2 weeks. Yeah, it's not very long. And the patients are paying, $150 to $200 to feel good for maybe a couple of weeks. So
I think I would say, I think we've said this before, if someone asks if we offer hydration services or vitamin services, like, I'm going to hand them a multivitamin and a bottle of water. Tell them to take a seat. Well, thanks, Cira. It's been so great to see you this week, and have some more goals for our company and how we will grow. And I am sure that somebody here on this podcast will talk about some of the things that happened this week and how this week can grow. If you want to know more, if you want to continue learning and laughing with us, hopefully a little bit of both, you can join us on Patreon. It's at Smiley Aesthetics, or we're all on Instagram. We've got, the handles, we'll include the handles in the description. But Patreon's a really great place to get content like this. I'll include the link to all of these things to help get you on the right foot and to ask the right questions as you move forward and consider, but we've changed our mind on offering IV therapy.